Like so many in our industry, watching the onset of the novel coronavirus spread across the world and across our nation spurred us to action. In March of this year, Lantana engineers participated in a hackathon where we looked at the data challenges of COVID-19 public health reporting and built a utility to liberate the data using US Core for data interoperability interfaces. Even though that was just a few months ago, it seems like eons. Since those early days, we've gotten a lot done. We've expanded the functionality, brought in partners and sponsors, and initiated a pilot with a major academic medical institution. We named it Nandina. As with Lantana trifolia, Lantana nandina is a domestic plant that looks and spreads like fire. Nandina is a flexible, extensible data reporting utility that can access data resources in vendor-agnostic ways, supporting and automating key portions of public health reporting workflows. Nandina is architected using microservices design patterns and is ready to be deployed in cloud environments or in traditional data centers. It implements OAuth 2.0 identity and authentication mechanisms and connect to an institution's authentication server or use open ID providers like Microsoft or Google. It is open source and has attracted attention from other projects such as the SANER effort and MITRE's C19 Healthcare Coalition. Lantana holds a contract with the CDC. We shared our ideas about Nandina and the progress we'd made and gained their support to explore further, specifically to automate portions of the data gathering for the NHSN's COVID-19 module's patient impact and hospital capacity daily reporting requirements. We reached out to the community, and we were encouraged by the response and interest. We identified a pilot site, and since early May have been collaborating with them and their EHR vendor to implement Nandina in their production environment. It's not without its challenges, asking us to be creative as we face technical and bureaucratic challenges, but we're innovating and adapting and making good progress. While FHIR-enabled resources are easy to work with and preferential in many ways, we know very well to meet the reporting needs, we will need to look beyond just FHIR. Nandina by design can be extended, and we are currently looking at query plugins that access CDA or ADT data feeds. We have also looked at building query adapters that can access a site's data warehouse through SQL. In support of NHSN, we are exploring ways to enable and automate the long-term care reporting pathway. We are members of the MITRE-sponsored C19 Healthcare Coalition and are participating in the Lab Testing Working Group, seeking ways to use Nandina to access these vital data. Currently, we are seeking 2 additional pilot sites to test against other EHR interfaces. Please visit the Lantana website if you'd like to learn more.